Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about telehealth visits post-PHE. As probably most of you know now, the PHE for COVID ended in May. Telehealth during the pandemic had a lot of looser requirements and made it a lot easier for providers, doctors' offices, entities to be able to utilize telehealth in ways they couldn't before the pandemic in order to be able to offer services to patients. This made it very convenient for patients and for providers, the things that they started allowing, and people kind of got used to that convenience. Since the PHE ended, it has been announced that there are going to be changes to the telehealth requirements, but for right now, they're keeping most of them in play. They're not changing anything until the end of 2024. That is because a lot of entities that be like CMS are going to be discussing things that they want to adopt permanently that they put into place for telehealth during the pandemic, and then other things that they feel is not necessary or whatever it may be, and they will take it away. They are leaving some things up to the insurance companies when it comes to billing that people are not aware of, and so I just wanted to do a quick video about this. Nonetheless, you want to make sure that you are checking all the insurance websites in which you bill telehealth visits to check and see what their specific requirements are. Like so many other things in healthcare, this isn't the same across the board. So what United Healthcare requires for billing telehealth might be completely different for Blue Cross Blue Shield, and that might also be different than billing maybe your local small insurances or your Medicaid plan. Medicare is also going to have their own requirements, so make sure that you are following that. And again, I'm a big fan of cheat sheets, and in order for everyone to be on the same page, I highly encourage you to provide everybody with one of those cheat sheets regarding telehealth. That will help the front desk, it will help your billers, it will help your providers and your mid-office staff as well. Some things to be aware of is place of service billing. Now, sometimes you can get away with billing your office visit place of service of 11 and using a modifier to indicate that it was a telehealth or a voice visit, because right now, part of the things that they're still honoring until the end of 2024, until there's new regulations put into place, is you can still do audible phone call visits for most plans. Again, it's up to the health plan, so you need to check. There are modifiers you would put on these claims to indicate as such. There's also different places of service out there that you can bill under that indicates telehealth. There's 2 and 10. So you want to make sure that you are sending these claims correctly on what's required, again, by the insurance company. The other thing is that they are now making most of them go towards patient cost shares, where towards the end of the PHE, this kind of already transitioned, where if someone was responsible for a deductible or a copay or whatnot, they started making it applicable to telehealth visits again, which they didn't before, but now they are. So a lot of times telehealth visits are going to be applied to patient cost shares just as if they were seen in the office. The last thing I want to talk about is going to be how they are maybe reducing their reimbursement for telehealth versus an actual face-to-face visit with a patient. Now, not again, all insurances are doing this, but it's very likely they're going back to the reduced benefit or reimbursement for a telehealth visit versus an in-person visit. And this was what happened before the pandemic. Telehealth visits generally weren't reimbursed the same, and it kind of makes sense, right? You're using a few less resources, you're not putting your hands on the patient, so that's kind of their justification of less reimbursement. You want to make sure you have someone in your office tracking these telehealth visits, especially if you do a lot of them, because you might need to reduce how many telehealth visits you do in a week in order to make sure that your income is where you need it to be for your practice. Maybe they're not covering things the way that you expected, and there's certain insurances you don't want to do telehealth for anymore. Maybe you need to send out a letter to your patients to give them a heads up and let them know what your changes are depending on telehealth and when you're going to start following these new requirements in your office. It is up to you as a business owner or manager to make sure that you're tracking these things, you're watching it, and you're making the necessary changes internally that benefits your business and your patients at the same time. Patient care is number one, of course, but you're still running a business and you have to make sure that not everything is charity or you're never going to be able to continue with your doors open, so you need to find that happy balance. If you have any questions or comments about this, please leave that in the comments below. I would love to hear from you if you do a large volume of telehealth. And of course, this is with the exception of behavioral health, because behavioral health has made some permanent changes for telehealth visits. So let's keep in mind, I'm sorry I didn't preface this video with it, that this is all for outside of behavioral health, all other specialties. So if you're in an outside of behavioral health, non-behavioral health specialty, and you have a high volume of telehealth and you've seen these changes and had to make changes in your practice, I would love to hear from you, so please leave that in the comments too. Sorry about that. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already. And please share this video with anybody whom you feel would be beneficial for them. Take care of yourselves. Bye-bye.